Let's say for a patient who does not want to wear glasses,
Right.
is scared of surgery, and is happy wearing contact lenses, how do you, what precautions should the patient take when he or she is wearing contact lenses day in, day out for 15, 16 hours a day?
Right.
Is that healthy?
No, it's not healthy. People do it all the time, but as
Yeah.
an ophthalmologist, we always see the other end,
Yes,
when they come in with
yes.
problems and all. Having said that, people do use contact lenses. They've been around for years now. It's not unsafe.
Yes.
Okay, in someone who has a high number. In fact, it's definitely better than wearing glasses in terms of the vision outcome that you would
Yeah.
get. So what I tell them is to be careful about the hygiene. You don't you make sure you wash your hands before you are applying or removing your lenses. Use a proper case. Don't use expired solutions. Don't use water. Just be a little particular about that. By and large, that's what I would explain.
Have you ever seen any complication happening with contact lenses?
All the time.
Really? What's
Because
the most common?
that's the end that we see. So I'm usually wary of contact lenses myself. So if I were to advise someone ki, okay, wear glasses, or if you don't want to, then get refractive surgery done.
Okay.
That way.
And so,
What are the complications?
yes,
I've
the worst
seen,
one that you've seen.
The worst one, just a very bad infection.
Really?
Yeah.
And they tend to damage eye permanently? The infections?
Well, that person ended up with a scar that caused proper damage. I mean, that would have required a transplant after a
So
point.
from wearing contact lenses, the patient went to a corneal transplant.
To a corneal transplant, yes.
So that way, I think a
So
refractive
the
surgery
patient
is...
forgot that there was a contact lens in his eye and came back to me after weeks. And I found that it was rolled up in his upper lid somewhere. And the entire cornea which is the front part, was just like melting, and it was in very bad shape. He was lucky that it had not burst open.
Yeah.
But
Wow.
that was was it.
It's better to get refractive surgery done.
Oh, most definitely.
For people, especially who are wearing contact lenses day in, day out.
Most definitely. And I mean, that's a worst case scenario, and like gross negligence, I would say.
Yes.
But even day in, day out, we see so many patients who have contact lens, chronic contact lens use, and then they have allergies and, dryness, severe dryness, or, lot of allergy in the eye itching. It's a foreign body after all. It's a foreign particle after all.
Right.
So then to such patients, and, they keep coming in, my eyes red. So then you may as well just let go of that and, be done with refractive surgery, since these patients clearly don't want to wear glasses.
Right.
So make your life easy.
So thank you for joining us, Dr. Shreya. Your insights were valuable, and hopefully our audience can learn something from this, and hopefully we meet again and we chat again. Thank you so much for joining us.
Thank you so much for having me here. It was a pleasure. It was a lot of fun.
Thank you.
Thank you so much.